Local nonprofit that provides free and low-cost dental services to veterans now says it's regrouping after abruptly closing its doors in June. Good evening and thank you for joining us. I'm Jamison Euler.
And I'm Lauren St. Germain in for Wendy tonight. It comes after the I-Team reported SmileFaith, based in Newport Richey, was telling veterans in the midst of care they would have to look elsewhere because the company ran out of money. And new here tonight, we have the emotional plea from one of the veterans. He had teeth pulled ahead of a dental implant surgery that he fears will never happen.
He talks with I-Team investigator Kylie McGivern as she questions SmileFaith about what went wrong and what's being done to do right by the veterans.
Probably about a year and a half ago.
Daryl McSweeney tells us his life has been filled with twists and turns, trials, tribulations, but it was his time as a teen
Went in at 17 years old.
that brings us to our meeting today.
I served aboard the USS Saratoga.
McSweeney is a Navy veteran who, like most, does not qualify for dental care through the VA. To receive benefits, veterans must have a service-related dental problem, be a former prisoner of war, or be totally disabled as a result of their service, meaning less than 10% of veterans who are enrolled in the VA healthcare system are eligible.
I had a lot of problems with calcium and things like that and wound up having a lot of bad teeth.
On Facebook, McSweeney came across an ABC Action News video on SmileFaith.
A new set of molars is giving Jasmine Johnson, an Army veteran in Tampa, a whole new outlook.
A nonprofit in Newport Richey offering free and low-cost dental care for veterans.
I'm like, wow, this is actually what it said it's going to do.
Since SmileFaith launched its clinic in 2018, the nonprofit tells the I-Team they have served more than 3,200 veterans, providing $2.9 million in free dental care.
They did a really good job. They did x-rays, they pulled a lot of teeth, and they got me prepared for implants, and that was my goal. I had to pay a little bit of money up front for the partial and a couple of the x-ray procedures that, out of pocket, and everything else was supposed to be covered for the implants.
In May, McSweeney received an email from SmileFaith saying, "I will keep in contact with you as we move forward in choosing implant candidates for each event. Please be patient as this could take several months." A few days later, he was told this process could take up to several years. Then, the next month,
I received an email saying, sorry, because of COVID and lack of donations, we are closing the program.
What went through your mind when they told you that?
How am I going to eat with one tooth? Because I have one molar left in the back, up and down, so I basically have this much space to chew with. They prepared me 100% for the implants. I go through all that pain to just not have it done? No, I would never expected it.
McSweeney is one of 194 veterans waiting for implants. A notice went out to anyone receiving care that the program was closed. SmileFaith gave veterans two options: Google free or low-cost dental clinics, or call a number for an insurance company called National Association for Medical and Dental. The I-Team found that Tom Lane, president of SmileFaith, is also president of that company.
It's just what happened, and to be let down like this, of all the mountains of things I've gone through the past year, was rough, really rough. And especially not knowing where to turn to. I don't have the money for the insurance. That's why I came to you.
We went to SmileFaith, where Mike O'Carroll, vice president of operations, agreed to talk, saying unlike the email that went out, they are not closed, but on pause.
We are in a process of reorganizing because we want to be stronger than ever before. Finances were just not there to help continue the program as we would want it continued.
O'Carroll said expensive care quickly ate up donations and funding, including a PPP loan SmileFaith received in 2020 for $31,700.
Our primary funding was through the benevolence of the founder, Tom Lane, and his corporation. They were taking up the slack month by month.
O'Carroll and Lane, veterans themselves.
We have big hearts, and we tried our best to help everybody with a need.
Will there be a difference with this kind of restart on whether veterans will have more of a guarantee, okay, we can see your care through?
Yes, I like that, Kylie. And we want to be able to take on these people's special needs and take them and follow them out until that need is fulfilled before we start taking on everybody else.
The details and timing surrounding a restart still unclear.
What happens to the veterans who are waiting to receive their full care, who are just in limbo right now?
We've done all we can do. Now, the veterans that are in the implant program, that's a whole nother story. We're not dropping those veterans at all.
McSweeney isn't convinced.
They should never have just left me hanging by myself at all. And just to cut me free after they couldn't do it anymore is wrong, 100% wrong.
SmileFaith tells us 22 veterans will have their crowns placed at the end of August.
We're not giving up on our veterans. I hope they're not giving up on us.
After seeing our report, Congressman Gus Bilirakis' office contacted the I-Team, offering to connect veterans with a network of Bay Area dentists to complete their care. Tonight at 11, you'll hear from the congressman about a bigger push to expand dental services to our veterans. I'm I-Team investigator Kylie McGivern, taking action for you.